Hi guys, welcome
to
back.
Surgery Squad's
Okay, thanks for cutting me off, you
surgery.
Susie.
I am Dr. Susie. I'll be guiding you through a LASIK eye procedure today.
You know what? No, I'll pause you. I'm doing an intro, okay? Okay?
Yeah, Susie, suck it.
Matthew, you are grounded.
I'm Ace.
What? You heard me.
Do you mind trying to do an intro? You know what? No, this is a good intro. I'm Ace. This is Matt, and that's Justice.
Amanda!
Why are we gaming? Now we're gonna go cut up somebody's eye.
Why are we gaming?
We're gonna cut open all of the eyes.
All the eyes.
Oh God, she moves.
And while we're at it, maybe some G's. Also some H's.
She moves. Okay, let's go. Let's just go.
LASIK eye surgery reshapes the cornea to provide improved focusing power and reduce a patient's need for glasses or contact lenses. LASIK is performed with a special laser that's used to change the shape of the cornea.
People want to know how it's
part
done.
of the eye that controls and focuses the entry of light.
Remember, children,
by doing so,
don't
we
try
can
this at
focus
home.
the light so
You're
the
grounded,
patient's
young man.
vision is
Go
improved.
to a friend's house.
Our patient's already had her preliminary exam. Her prescription hasn't changed for more than a year, and she has no history of eye disease or injury. This qualifies her as a perfect candidate for the surgery.
Want an apple?
We want to make this procedure as pain-free as possible, so we'll use drops to numb the eye. Can you place a few drops into her eyes?
This is not the time for apples. This is the time for recording videos.
I'm gonna need an apple then. So can I shove my apple in her nose?
No.
I want to shove this up her nose.
That the patient can feel pressure and mild
This is
discomfort.
very inappropriate, young
do
man.
help
You're grounded as well. Go to
overall
your
day.
room.
This is my
Debris can
room.
complicate the
Go
procedure.
to the bathroom.
So we need to make sure that the area around the eye is clean.
Ow.
Now that the area around the eye is clean, we'll use a device called a speculum to hold the eyelid
Enjoy your
open
apple?
wide.
Yep. It's
So
very
let's get that
delicious.
speculum over. If the patient was allowed to blink, we might cut or burn the wrong area.
My sister's
At this
eating an
point,
apple during
we'll
this
also
video,
mark
so
the
you
corner
know
Yummy
what?
with
apple.
You know what?
water-soluble ink to guide our placement of the
It
flap.
squirted me in the
Now
eyeball.
we place a
I
suction
actually
ring
plugged my
over the
headphones
eye.
into an apple.
And it squirted me in my eye.
The ring sucks the cornea upward, making it easier to cut. The patient's vision will likely dim and blur, while the suction
You
ring
wouldn't look
is
too
attached.
good either with a scapula in your
For
eye.
this next step, we're going to
even know what
slice
that is.
open a flap.
It's the thing
on
that holds up the
cornea.
eye, apparently.
To make the
Right,
corneal
this is the
flap,
good part.
we use a
Good part.
mechanical microkeratome. This is a fancy name
yeah.
for a blade device that's attached to the suction ring.
I think I've used one of those to make
Slide it
potato
across
chips before.
and it cuts
Is
the
it
top
me, or
20%
does she
of the
look like
cornea.
she's a little manly?
Here we go. Slide the microkeratome
Oh, my
along
favorite
the
part.
track
My
to
favorite
create
part.
a thin flap in the cornea.
Oh,
You
Oh,
guys
yeah,
are
look
sick and disturbing.
Oh, yeah?
stuck.
Oh, yeah?
Oh, yeah, look at that.
Hey, Matt, you want some apple?
With the corneal flap cut,
Sure, toss
we
it here.
remove the microkeratome and suction
Toss
ring
it to the
and
computer.
then peel back the corneal flap to expose the middle part of the cornea.
Go ahead. Expose that flap.
Don't stop till you get it up.
You're not exposing the flap.
I'm.
Poke it in her ear.
This is
There
the
we
part
go.
we'll reshape with a laser.
Oh, yeah, look
The
at that.
computer-controlled laser is positioned over the eye. By analyzing our patient's data, we've pre-programmed the laser to tell it how much corneal tissue to remove.
All
A
of
flip
it.
of the switch to fire up the laser, and the reshaping process is underway. Pulses from the laser will correct the shape of the
That
cornea
noise.
in less than 60 seconds. The laser makes a slight clicking sound, and you might notice a faint smell similar of burning hair. And that's it.
Smells
Please
of
fold
bacon.
the corneal flap back into the original
Smells
position,
like breakfast.
making sure our ink guides match up.
Alright.
Sure, the ink guide's match up.
Nicely done.
It looks
While
good.
you were working, I went ahead and took care of the other eye.
Wait, as
We'll
I was
observe
doing
our
one.
patient for
This
several
bitch is
minutes
gonna be
to
blind.
ensure the corneas bond correctly. The cornea is quite amazing in this respect. It will be bonded back to each eye in moments. Even with the corneal flap bonded back in place, the cornea is still vulnerable and could dislodge if the patient
Why did we do
isn't
both
careful.
eyes at the same time?
That's why we put a
She needs
clear
time to
protective
heal.
shield over each eye. This keeps the patient from
Or like
being
it look like a
over her
retarded
eyes.
fly.
The patient will notice the improved vision immediately, or as soon as the numbing drops wear off. She may now be driven home, as she won't be able to drive for a day or two. She'll come back within the next 48 hours so we can remove the eye shields, test her vision, and examine her eyes to make sure everything is healing up nicely.
So they basically
And there
just
you
poke
have
her
it,
in the eye.
another successful
With
surgery.
lasers.
You can see
They
more
use
of
the
my superior
lasers.
surgical technique and my other procedures here on
Please don't
surgerysquad.com.
spoil my apple.
The lasers.
My apple.
Well, this is me and Ryrie Gaming, and I like lasers.
I like lasers.
I like apples.
Like, comment,
Same
subscribe.
things with